Good morning, and thanks to everyone for being here. I think this is an exciting day where we start to address a critical need that is present across the state. I want to particularly thank Colonel Phillips and his state police for being here, and all the health and healthcare providers and the public health community. This week, there'll be over 1,200 crashes on highways and roads across the state of Arkansas. It'll involve over 3,100 people, and if last year's statistics are predictive, 20 of those will die. We don't know where those will be, but Colonel Phillips' troopers across the state can tell one message that's critically important. If you're in a car, buckle your seatbelt. Okay, that's what each of us have as a primary responsibility, is to buckle our seatbelt. But we have a number of health and healthcare providers that when we have one of those motor vehicle wrecks or an injury from some other worker's problem or other issue, falls or other things that happen, we have a healthcare system that is ready to respond, and we have well-intentioned doctors and hospitals, but we're not doing what we can to coordinate their services together. And I think we've worked on this over the course of the last year and a half, and we've got at least the start of a plan. And I want to thank you for being here and turn it over to Governor Beebe, who has committed his administration to making the citizens and families and communities and businesses of Arkansas be the place that everybody wants to live and grow and prosper. So, Governor Beebe.
Well, first of all, I'd be remiss if I didn't tell you that the leadership of Dr. Thompson as our Surgeon General is critically important to the evolution of all of our policy as it relates to health care. He spends his days trying to think of ways to improve the delivery system, the quality of care, the affordability, the accessibility, and it's his job primarily to help guide and focus public policy in this administration in this arena, in this regard. And while this is just one component of where he spends a lot of his time, this is a significant component. You all know, and people have reported for a long time now, about the interest in the legislature with regard to a trauma system. And that's really kind of what we're talking about. We're not talking about a trauma center. Trauma centers are components of a trauma system. But Dr. Thompson works obviously with the Department of Health as well, and Paul and his people to try to coordinate all this activity. This is really the first starting point of what is necessary in order to be able to have the kind of information, the kind of coordination, the kind of communication that ultimately a trauma system will have to have as a baseline in order to even go forward. Let me just put it in some real layman's terms from my standpoint, which I think helps most of it. It gets away from the health department, it gets away from the Surgeon General, it gets away from the physicians, and it just reduces it, I think, to an arena that a layman like me can understand. If you are involved in a trauma, whether it's a car wreck or whether it's an electrocution or whether it's an accident at home or a gunshot wound in the hunting woods, whatever the trauma might be, the emergency responders, firemen, emergency medical personnel, policemen, all of the people who initially respond can best serve and help and aid if they have a place or a mechanism where they know they can go find out where the nearest best place to treat whatever that particular kind of injury is, whether it's burn, whether it's neurological, whether it's orthopedic, whether it's a heart, whatever it may be. That's really the essence of what a trauma system is, but it requires total commitment and coordination. We're grateful for the hospitals and medical personnel that are here to try to help and make this happen, whether it's a Baptist or UAMS, they're all here. But this really needs to encompass all of our medical care providers in the whole state. And we're going to ask all of the hospitals and all the medical care providers in the whole state to participate, so that if one of our troopers or one of our ambulance operators, emergency medical technicians, is confronted with a situation where there's a particular type of injury or trauma, they can then punch buttons in our computerized world to figure out that the nearest hospital with a neurologist currently on call working at 2 o'clock in the morning is Hospital X, or the hospital that has currently on call the brain surgeon that might be immediately needed is located at Y. You don't need to send a patient that's suffering from trauma to 4 different hospitals in route of trying to figure out where the qualified care is currently on call, especially at 2 o'clock in the morning or 11 o'clock at night or on Christmas Eve. So the starting point for any trauma system is the coordination of information necessary to have everybody in the mix know what to do in a timely fashion, real-time fashion. And that's what this is all about. Real-time communication of information among the whole gamut of people involved in this system. Law enforcement, firemen, emergency medical personnel, doctors, nurses, hospital administrators, everybody working together with this communication. So to that end, we have seeded this and started this early process with $200,000. If we have that check somewhere, actually this won't cash, but I think it's pretty good for purposes of illustration to initiate the gathering of information and the implementation of hardware and software as the first step for wherever we may go. And we don't know yet where we're going to go. Trauma systems can take a number of different directions. You can have a level 1 trauma center. You can have 3 level 1 trauma centers. You can have 5 level 2 trauma centers. You can have 12 level 3s. It depends on a number of things. It depends on cooperation. It depends on revenue. It depends on resources. It depends on personnel. All of those things enter into it. But no matter what type of system we have, no matter how many different levels we have, this basic information and the ability to communicate in real time is going to be a prerequisite for whatever ultimately occurs. So to that end, Paul, here's a fake $200,000.
It'll spend, Governor.
And the real one is there as well. So, Paul?
Thank you so much, sir. Well, Governor Beebe, on behalf of the Arkansas Department of Health and the Governor's Trauma Advisory Council, Dr. Graham and Dr. Grunwald are here as leaders of that council. Let me say thank you. But the thank you really, I think, comes from the thousands of Arkansans and other visitors to our state that will benefit from an effective trauma system. As you may know, the leading cause of death for people between the ages of 1 and 44 in our state is injury. A trauma system is a critical component of an effective injury response. We believe that an effective trauma system, again, using the governor's example, it's not just a hospital, it's not just good EMS system, it's not any of those things. That we have wonderful components. It's the way in which all of those components work together. It's a system that's predictable, that will create for Arkansans an opportunity to be a survivor, to survive a major crash, to be able to live without disability and to live an improved quality of life. The great advantage that we have in Arkansas is that we have a can-do spirit, and I think that we're going to make this happen. I think this has been a dream of a number of people. Many of them are here today. And I hope that what we can do today is to mark this day in our calendar as the beginning of an important process that will lead us ultimately to an effective trauma system for our state. So, Governor, thank you very much. Thank you for your leadership. We look forward to continuing forward.
Thank you. All right. Yeah.